Separation anxiety in dogs is an increasingly common behavioural disorder which directly affects the well-being of a dog, causing anxiety and generalised stress. It can also lead to long-term health problems. In this video, AnimalWised explains the causes, symptoms, treatment and management of this disorder. Separation anxiety is defined as the state of stress a dog can reach when they do not have access to their guardian. This state does not occur because the animal feels a dependence on their human companion, but because they are unable to manage their feelings of loneliness and separation. It is therefore not an obsession, but an over-attachment bond and an inability to maintain well-being when alone. For the dog, the owner acts as a reference figure who guides and provides protection. In other words, they are security. When security is not there and the dog has not learned to cope, it leads to stress, fear, frustration, and anxiety. This causes them to present a series of unwanted symptoms and behaviours. Premature weaning is one of the most common reasons for the development of this disorder. Likewise, moving, home, or abandonment are among the main causes. This is why it is common to see this behaviour in adopted dogs due to the separation experienced with their previous owners. These are not the only reasons. It can also happen in dogs which become used to spending a lot of time with their owner before suddenly having to spend an extended period alone. Abused or traumatized dogs may also develop separation anxiety. Dogs suffering from separation anxiety may manifest the following symptoms: destructive behavior, excessive barking, urinating or defecating indoors, vomiting and/or diarrhea. Likewise, it's also possible to manifest the following secondary symptoms: appetite loss, not drinking, ignoring toys. But how is it diagnosed? We can see our dog suffers from separation anxiety when they show these symptoms every time we leave home. They will manifest them whenever they are alone, even on short trips of just a few minutes. To treat this problem behavior in dogs, we must find the initial cause. Only this way can we work on the symptoms the dog displays. The form of therapy will need to be prescribed by a veterinarian or a qualified ethologist. The therapy will include behavior modification techniques, but the vet may also prescribe other therapeutic remedies such as pheromones or even anti-anxiety drugs. Here are 6 basic guidelines for separation anxiety treatment. We can start by developing a routine of walks, activities, and exercise with our dog. We need to implement it progressively and strictly follow a schedule. We need to avoid scolding, punishing, or saying no to them when they are anxious. Instead, we need to reassert basic obedience commands such as sit or stay to maintain a calm attitude. Until relatively recently, one form of treatment was to make false exits outside so the dog would not know when you're leaving for good. However, a recent study shows that dogs can suffer generalized anxiety throughout the day. Dogs which know when their owner is going to leave, either through physical signals or specific schedules, usually only show anxiety when they are left alone. The professional will explain how to make progressive departures from home and how they work. We will start with very short trips between 1 and 5 minutes, and progressively will increase the time in which we leave the dog without supervision. It's essential we offer an enriched and comfortable environment so the dog feels comfortable in our absence. Keeping a light on, food dispensing toys, or soft music are some examples. The use of soothing pheromones can also alleviate stress when we're gone. Separation anxiety is one of the most complicated problems of maintaining a life balance with companion animals. In some cases, it can take months. You need to be patient and follow all guidelines recommended by the professional. We currently have cameras which allow us to monitor animals when we are not at home. In this way, it's easier to establish an appropriate course of action and verify whether our established guidelines are working or they need modified. Some cameras have a night vision feature. This allows us to see how the animal is doing even during the night time. You may also be able to have a speaker which you can talk through remotely, but this is not a good idea for separation anxiety since hearing our voice but not seeing us can be stressful to the dog. Cameras can be very good for verifying the effectiveness of established guidelines, helping us to see patterns of behavior which allow us to better identify the cause of anxiety, and also to adapt the treatment to obtain better results. Finally, we must point out that medication can help improve the dog's state of mind and assist the behavioral therapy. However, any drug needs to be prescribed by a veterinarian. Also note that medication does not treat the problem, but only acts to relieve stress and related symptoms. In order to treat the problem effectively, it's necessary to use progressive behavioral modifications and therapies prescribed by a professional. If your dog suffers from separation anxiety, do you have any tips which have helped you? If so, leave us a comment. Like and subscribe if you found the video useful, and we'll see you next time.